New at 9, a local ALS patient tells me he wants to see the FDA approve treatments as quickly for ALS as they are for COVID-19. May is ALS Awareness Month, and he's leading a group that will hold a body bag protest in D.C. tomorrow, hoping our nation's leaders will take notice. This is a body bag covered in stickers. One reads, ALS is undefeated and the FDA is protecting us to death.
ALS is 100% fatal 100% of the time.
And that's why Mike Henson of Broken Arrow is packing his mask, risking his own health to lead a group of patients to protest outside the White House in the Health and Human Services building. His Facebook group, No More Excuses, has more than 5,000 members, and that's where he'll carry the protest live. Unlike last year's protest, this year's group will be smaller because of the coronavirus. Still, their message is big, demanding fast approval for treatments showing great promise for ALS, like we've seen for coronavirus, instead of waiting years for FDA approval.
There are at least 6 therapies, Shay, right now, 6, that could fundamentally transform this disease into a manageable condition for the first time in history.
One treatment called Neurone I first told you about in February. It uses an ALS patient's stem cells extracted from their spine, treats them in a certain way, and injects them back into their body. I introduce you to Mark Bedwell, who could run once again after receiving the treatment during the clinical trial. He had been losing his ability to walk. Another patient confined to a wheelchair, Matt Bolina, could stand once again. This treatment is in its phase 3 trial and not expected to wrap up until October. The Israeli company behind the treatment, Brainstorm Cell Therapeutics, and the FDA have said if the data from the final trial is positive, they'll work together to try to speed up approval. This statement made by Dr. Anthony Fauci in the White House talking about remdesivir to treat COVID-19 caught Henson's attention.
Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access.
Henson believes he got the placebo in the Neurone trial and wants anyone who did in this and other trials to get the real deal.
We certainly have no problem with what's happening with COVID. It's actually a good study in what can be done right when you want to do things right in the government. But for us, our contention is hey, ALS is just as devastating, if not more. For them to be doing all of this for COVID and nothing for ALS, it's inhumane, frankly. It's un-American.
Yeah, Henson knows COVID-19 is a virus that spreads easily, while ALS is not. But he's pointing out to our health and government leaders, ALS is always fatal, while the coronavirus is not. I did ask the company about Fauci's statement and whether ALS patients who receive the placebo could get the real treatment. And they tell me it's a blinded study, so they won't know the placebo group until it ends later this year. Now, we'll be sure to follow up on tomorrow's